Yes, this is Karen Thomas. I will be reviewing Chapter 16, in which we are going to look at alternative sources for research, including the Internet, secondary analysis, and historical research, and the advantages and disadvantages of each. The Internet provides access to resources, including published works and historical archives, while providing a means of communication between researchers as well as enhancing data collection. Online surveys replace paper and pencil while data is more accurately obtained. Participants can remain anonymous when collecting data on sensitive topics, and various behaviors of information sharing can be studied. Disease and health outbreaks can be tracked more easily through a specific website. And the Internet also provides an increased access to a larger, more diverse population for participant selection. There are various techniques to obtain participants through the Internet. With recruitment, participants who have been identified to meet eligibility criteria through previously obtained information are contacted. These participants are volunteers in standing panels. Examples of these can be found on page 275 in your textbook. Pre-recruited panel participants are initially recruited through phone, mail, or in-person contact. Access is obtained through organizations such as churches, schools, and other groupings. Then volunteers are directed to complete a survey online. A commonly used site is SurveyMonkey. Participant selection for harvested email addresses is often considered unethical by some review boards. Email lists which have been harvested through internet postings or by visiting certain sites are then sold by brokers. Low response rates and unknown characteristics of participants are common. With list-based sampling, again, members of large groups such as professional organizations, support groups, or electronic mailing lists are contacted, but specifically through email. IRB approval is needed if large employers, universities, or organizations are utilizing their own email lists. With self-selected surveying, participants click on a banner or a link that's on a website that's being visited by the people that have the desired characteristic that you're looking for in your sample. Intercept surveys are pop-up surveys that pop up when visiting or leaving a website. Pop-ups can be blocked, which decreases the information of who responds or not. Computer-assisted testing, or CAT, is historically successful and can be designed to be specific and applicable questions. For example, if you do not drink, then questions concerning how often and how much will not come up. With electronic measurement, it assists with measuring participant response time, attention, and field of vision tests, which are found to be useful with driver testing. Automatic complex scoring in an analyzable form is generated. Currently, smartphones are predominantly used to track food intake, exercise, sleep, activity, and conversations. Data is automatically transmitted with immediate feedback provided or stored in a cloud. Privacy issues, cost of the phone, unfamiliarity, and complexity of the programs are identified as barriers. Tappen further directs you to her references of Best and Kruger, 2004, and Dillman, 2000, for further information about constructing web surveys. Interventions that can be monitored via the internet are health education, online counseling, support groups, and diet planning and monitoring. Peer support, counseling, and psychoeducational interventions are other ways people can receive help also through the internet. Quality considerations include selection bias, validity, and inauthentic responses. With selection bias, probability samples needed for quantitative studies are unattainable with current internet recruitment techniques. Best and Kruger, 2004, identified two ways of obtaining a probability sample via the internet. The first is if a complete mailing list of the people in your population group you're looking for is utilized, such as staff in a hospital or a university student body. Or two, if the population of interest is defined by visiting a specific website. Other barriers to obtaining a probability sample include people who have little or no experience with the internet, such as the elderly, or people who have little or limited access to the internet, either by outdated computers or dial-up services in rural areas. With validity, significant differences in online responses and interview responses have been found, specifically data on sensitive topics, which is more likely to be reported on the web. Inauthentic responses can occur with crowdsourcing websites when an individual wants to qualify, specifically when some type of incentive, such as monetary, are offered. Acceptability, willingness to participate. Is the online survey easy, convenient for the participant to complete? Are there incentives available that can promote participation? Also, participants should be informed that information is being shared with other visitors to that specific website. It's recommended that your IRB coordinator be consulted and that current standards be followed during the planning phase to ensure that you are protecting the rights of your human subjects. Special ethical concerns includes questions of privacy and the protection of human subjects. Ethically, can public information and should it be used for research? Utilization of an online survey such as Project Implicit can obtain informed consent. Participants should be informed that information is being shared with other visitors to the website. It's recommended that your IRB coordinator be consulted and current standards be followed during the planning phase to ensure the protection of your human subjects. Secondary data analysis is exactly what it says. It's a secondary analysis of previously obtained data that focuses on a different question. It can be used for quantitative or qualitative studies, but commonly in quantitative work. Usually it's data that's collected for previous research, or it's from big data that has been used for other purposes such as insurance records, pharmacy benefit records, Medicare billing data, and can include numbers, images, which include video, narratives, and so forth. It's often difficult, though, to put that in an analyzable form. Secondary data analysis is a second return on the initial investment or funding for the first research study. The National Institutes of Health require a statement of plan of data sharing for proposals requesting $500,000 or more per year due to the minimal monies available for research. Sources of data sets can include government data sets such as the U.S. Census Bureau, that's a popular one, large clinical trials, small study databases, and qualitative databases can all be used as a source for secondary analysis. Advantages of secondary analysis include resourcefulness. You have actually saved time and money by using existing databases that are clean. The quality is high, reflecting the expertise of those that had previously done the work. And evidence of acceptable reliability and validity are often evidenced. Disadvantages include difficulty finding appropriate information. It's not sample specific for you, and the focus of the previous study is not what you're focusing on. Variable difference is also a disadvantage. And the data presentation is not often in the form that you would like to examine. Also, software compatibility to create databases can play into disadvantages. There are often restrictions when assessing existing databases due to participant identity protection and erasing of previously obtained sensitive data. It can be a costly application process to obtain that information. Security will need to be increased to protect identity. And then you may often have to learn new software to be able to utilize the databases that you are obtaining. The lack of common nursing terminology has also hindered the ability to do secondary analysis because there is no consistency in terminology used. Tappen describes 4 different systems that are available that could enhance communication between researchers. One is the Omaha system, which is commonly used now in community health. Also, the systematized nomenclature of medicine, which is SNOMED, is used for nursing diagnosis. And then we have the logical observation identifiers names and codes, which is LOIN-C for assessments, and then the nursing management minimum data set elements. Standardized terminology could be used to foster the conduction of research. In secondary analysis, it can improve communication and patient safety when the patient transfers or transitions to another setting. Historical research looks at past nursing history for professional heritage and to explore past nursing practices and applicability to today's nursing evidence-based practice. The 3 major phases in historical research are discovery, appraisal, and synthesis, and we will examine the steps to each phase. It is important in topic selection and title composition to be prepared and familiar with your subject. Keep in mind potential contribution of the study and explore what is known and unknown about your subject. The title should be informative, it should be interesting and creative, and it should be focused in order to keep the researcher on track. Discovery is the search phase. Primary sources should be utilized instead of secondary sources, and they include interviews, archives, websites, photographs, and statistics. Interviews are oral testimonies of undocumented experiences that occur in the privacy of a patient's home or in their room in the hospital or nursing home. Archives contain original, unpublished records and documents, unlike libraries that contain published materials that are secondary sources. Material from secondary sources should be examined prior to review of archives to put your subject in perspective. The American Association for the History of Nursing has a list of multiple archives of nursing and health care related materials in the United States. A list of these can be found in your textbook on page 286. Ethical concerns arise when using records that contain personal health information. Release of documents related to personal health information may be difficult to obtain without the individual's permission, which is required by the Health Insurance Portability and Accountability Act, which we know as HIPAA. The overseeing IRB can assist in obtaining a waiver, which is preferable, or the data can be de-identified. Photographs offer a visual narrative in documenting and interpreting behavior, settings, or events. Statistics are often included in predominantly qualitative historical research and often are incongruent. Appraising the data is the analysis phase of a study in which quality or trustworthiness is established and the material is organized. Rules for estimating quality of the data include the following: two independent primary sources that corroborate establish a fact. One primary source corroborated by a secondary source with no contrary evidence also establishes a fact. Data from one primary source with no substantial contradictory evidence, or from two primary sources with only minor disagreement, establishes probability. If the data are only from secondary sources provide corroboration and/or neither fact nor probability can be established, then there is only a possible connection. Secondary sources also need to be evaluated for trustworthiness, and it's important to establish that partial evidence of trustworthiness. According to Wood in 2011, some guidelines to evaluate a historical document should include provenance, that's the type of document and its source, purpose, why was this document written or created, context, the social, political, and geographical environment in which it was created, veracity, that includes values, assumptions, and biases that may have been introduced in the creation of that document, and usefulness. Does the document provide information not available elsewhere? Organization of the information can be done in a time sequence manner in which it begins with the earliest events to the latest events or the culmination of that event. Geographically, in which we compare events in different geographical locations, such as what happened in the United States versus what happened in South Africa. Or it can be organized by topic or category. That's like the example given by Tappen was a patient staff administration experience, or based on the activities of the primary actors, which would be like nursing leaders, for example. Tappen cites Fitzpatrick's commonly used frameworks for analysis and interpretation of historical materials that include social forces. An example of that would be women's rights movement and the effects that it had on the nursing profession. A great person, which an example would be a biography of one or more nursing leaders. Psychological, with the example of being the analysis of the reasons why Florence Nightingale opposed licensure for nurses, and then economic or political forces. And the example given in the book is the passage of the Medicare and Medicaid legislature and the effects on the Great Depression. Synthesis is the phase of interpretation of the organized material. Historical commentary is identified in which the meaning of the event or the leader at the time of the occurrence and the impact for the present and the future is identified. That is done by interpretation in which the material has been synthesized and conclusions have been drawn. By looking at past nursing events and practice, successes and failures, a new perspective can be born. In conclusion, the three data collection strategies discussed by Tappen in this chapter have different purposes in research, and they point to various questions of data quality, protection of human subjects, and access to participants, and applicability to current areas of focus in research. With the increasing availability of technology and its capability to track and measure data of individuals as well as the public at large, raises the question of privacy and consent of participants, validity of the data, as well as sampling selection and bias. While individual interventions, education, and counseling can be easily provided based on data obtained and the programs that are being utilized, caution must be used. Personal data may not be accurate because of perception of the individual on what is desired or perceived to be the correct answer, nor may the subject be aware of the purpose of the various surveys prompted by the internet and the information sharing of this data. The value of secondary data analysis is promoted as a tool to look at past studies and find further value in the original research, thereby increasing the return on funded research. Studies performed in the past, including large and small data sets, along with government-based studies, must be evaluated by synthesizing the original work to identify and extract a secondary data outcome. Looking at the past through historical nursing research provides the basis of future research and validates the role of nursing in the past as well as in present day. Reviewing the past of nursing care is invaluable in the framework of today's evidence-based care. By including historical research background in nursing curriculums, positive and negative outcomes can be identified to direct future nursing research.